Senator Becker and I introduced legislation last session. It was kind of introductory just to get this topic discussed, and so I do appreciate this opportunity. Dr. Stafford from the IU Center for Aging and Community brought the idea to us. This committee has spent a lot of time talking about aging in place, talking about alternatives to nursing homes. And Dr. Stafford got us thinking about a new way to approach this whole issue of aging in place, which is a much more comprehensive view. And so we wanted to give the committee or commission this opportunity to hear a little more detail about his ideas.
The Division of Aging and the University of Indianapolis Center for Aging and Community have done some terrific work in several Indiana NORCs, or naturally occurring retirement communities. These communities have begun the work of empowering seniors in local neighborhoods to set an agenda for themselves that helps assure people can age in place with dignity and independence. In addition to the NORCs, many other Indiana communities have begun turning their attention to this issue. Older people themselves, myself included, operate with a different take on the notion of health. When I was director of senior health services at Bloomington Hospital, we often asked elders, what do you want the healthcare system to do for you? Uniformly, the answer was to help me manage at home as long as I can. Older people are intuitively aware of the identity between health and home. To plan communities that would be good places to grow old, we must first break down the old silos that fragment the issues in the very bodies of older people into separate parts. With good intentions, we are making some serious mistakes in the way we are approaching the issues. We have built Peter Pan suburbs where loss of driving ability means loss of nearly everything. We build senior housing in cornfields, creating new dependencies that require seniors to pay in their rent for things that a natural community would make available to seniors by virtue of their own labor. And tragically, we are at the same time contributing to sprawl and to the decline of our downtowns, which, when you think about it, would make wonderful living environments for seniors in the heart of their communities. It's quite timely that a federal bill entitled Livable Communities Act is now making its way through Congress. This bill will echo the approach taken in the Indiana bill, providing incentives for communities to conduct serious and comprehensive planning for livability and resources for communities to take action around priorities. If Indiana communities undertake the systematic and participatory planning that the future requires, they will be well positioned to be highly competitive for the prospective federal funds.
Over the course of my 29 years as the CEO of CICOA, it became quite clear to me that the provision of long-term care services to Hoosiers should be community-wide inclusive and not just the programs and services for which area agencies on aging are responsible. It must include community-based care and institutional care. It must include governments at all levels, planning agencies, housing agencies, transportation entities, healthcare providers, and so forth, and advocates must be kept abreast. This is what this legislation is about, to provide vision, leadership, and incentives to local communities to plan for the aging of their communities